Hello, I'm Donal Macaulay from BJGP. Today I'm talking to Professor Mark Cucuzzella from West Virginia in the USA.
Yeah, so in America now, we're several months into COVID-19. We were starting to prepare in earnest, probably late February, March, before things really started to shut down. And we have certain populations we know from every single viral outbreak, whether it's influenza or some novel virus, that the urban populations, population density, those with metabolic disease, obesity, diabetes, cardiovascular disease, aging, so all the usual suspects, these are the vulnerable groups. They tend to be groups that we need to immunize if such a thing exists, or kind of protect by isolation, keeping home. So it's certainly not surprising that with COVID-19 that the population now that is impacted greatly is the African American population, much more so than the white Caucasian population, even when you look at things being equal. So we know that I think the most recent papers are showing that 90% of patients that are entering an ICU have a comorbidity, and that greatly increases also your risk of death. And we see in populations such as New Orleans, Detroit, some of the neighborhoods in New York City, that the prevalence of these adverse outcomes, ICU and mortality, are much greater in the African Americans. Now, I think several things can play in there, so we certainly know that in these populations, the prevalence of obesity, diabetes, cardiovascular disease is high in African Americans, but it seems like there's still a higher adverse rate, even matching that to the white population. Say you got a patient with a BMI of 40 and an A1C of 9, why are more African Americans adversely affected? So I hope we learn from this, because this is not going to go away in the next year. I think we're going to be dealing with COVID-19 and certainly every other virus that's going to, hop across landscapes, for years in my career.
One of the big differences between family medicine in the US and in Europe is that you have this concept of the hospitalist. So you follow your patients right through from first consultation to the hospital.
So I'll spend out of a month, I would spend 1 week just in the hospital as a hospitalist, where we have resident teams, and I'm not seeing clinic that week, so just in the hospital. And other weeks I'm in the clinic doing some general work, some specialty work with obesity and diabetes. Right now I'm in, because of COVID, we've created these respiratory clinics, meaning if someone called a regular GP office and said, I have a cough and a fever, they wouldn't tell them to come into the waiting room. So we've built out the outlying clinics away from the main clinics and hospital, where we actually see them in a car. And that's where I'm about to go right now, I get on the phone and I get the history and then I'll go out. I have all my PPE over here. I'll don my PPE, go do an exam, get a history if they need to be screened. So we're all kind of like GPs, right? We're generalists. So we are flexible in how we work. But most of what I'm doing in my hospital with my trainees is how do we protect ourselves and protect our staff? So a few weeks ago, people were pretty cavalier, even not even wearing masks around. And it's just, we need to model, look, we need to take care of ourselves. We have to pretend every single patient is a potential COVID because it's asymptomatic, because you start unprotecting yourself because you think someone doesn't have the infection, and now you've just taken out your whole team. But we're trying to keep that humanity in our care too, because I think we've extracted some of that with all of this, so I think that's a real challenge too, as GPs, really we do value that humanity and personal relationship with patients. We're trying to somehow keep that.
Today I've been talking to Professor Mark Cucuzzella from West Virginia in the US, who gives a very different perspective of care of COVID-19 in a very different healthcare system. Mark, thank you very much indeed.
It's a privilege, and keep doing good work, and we'll all get through this together.